This is the newest version of our system. Of course, we've been doing this for a little over 20 years, and your kit that you have may not be this exact one. This has only been out for a few months now. Contents might vary depending on the kit that you purchased from us. This is a fairly complete kit. It's got all the various types of wedges, rings, instruments, and so forth in there. But perhaps, the material that you have, let's take a look at some of these older materials here. We've been doing rings for a long time, so maybe the rings that you've got that you haven't started using yet might look something like those. The technique for these types of rings is very similar to what we're going to take a look at here this evening. These real thin, wire-tined rings, the technique there is a little bit different. I'm not really going to cover that here this evening. But your technique on this style of ring will be similar even if you're using a, let's say, a Paladin Plus ring, a Trident ring. There's some material out there from Dr. Clark, BioClear, I believe they call that. It's got a similar tip design as far as fitting over the wedge. That's what's common between the systems I just mentioned, is how they fit over top of the wedge. Your bands might be a little bit different. So these are some of the older styles of the matrix bands, the original ones from back in 97 and 98, and then up to the newer coated matrix bands. We'll take a look at the specifics of the fusion bands here so that you can identify those easily. So but whatever the material you have, the technique is fairly similar. So we'll get all the old stuff out of the way here. Let's take a look at the new stuff. The separator rings in the fusion system come in 3 flavors. The difference between the blue and the orange is the height of these tips. You see how the blue one is a little shorter, the orange one is a little taller. There's a couple reasons for that. The first is if you've got a shorter tooth, this one is going to provide a little bit more intimate fit. Taller teeth, of course, you go with the orange one. The functionality is the same. If you are going to do an MOD, you put the blue ring on first on the mesial and the orange one on the distal. You can see how the difference in heights and the angulation allows them to be easily stacked for those types of restorations. So, but in an MO case like what we're going to do this evening, there's really not a lot of difference there. You could use either one of them quite successfully. Now the green ring is quite a bit different. It's kind of a specialty item, and you would get into this when you're doing a restoration that is a lot wider, where it does extend past the line angle. Like we can show you on the Type It On. I've got a tooth prepped out that way, and you can see where that would come in handy. So this one you're not going to use as much, depending upon your patient base and whether you're doing those types of restorations on a regular basis. The blue and the orange are going to be your workhorses. So the function of the ring is to help adapt the matrix band to the tooth and is the primary separation force to help you achieve that nice tight contact. So you can see, particularly on the blue and the orange, see that little white area right in the middle of the blue on the tip. The plastic, that PEEK medical plastic, extends all the way through the silicone there so that it engages more deeply between the teeth to help drive those teeth apart, create more separation. The plastic on the back of the ring aids in the strength of the ring, the amount of separating pressure it's producing, and the longevity of the ring. So that's why that is there. It's not just a cosmetic thing, it is functional. The colored portions on all the rings are silicone, and that helps to adapt that band to the tooth again. So let's take a look at the matrix bands, and we'll talk about how to pick the proper matrix band. The typical kit has 5 sizes of bands in it. There are 2 with subgingival extensions. The blue and the kind of burgundy-ish red here have subgingival extensions on them. If you do have some deeper caries that you're dealing with, again, don't do that on your first case. There are 3 sizes without the subgingival extension, and selecting the band it really comes down to what is the height of the tooth. There's not, I can't say that, you know what, this is the molar band, you're going to use this on every molar. Well, if the molar's a little shorter, you'll do the mid-size band, or if it's really short, you might use the gray band. You want to match the height of the band to the height of the occlusal margin of that tooth. You don't want to have one that's far too tall. What happens then is you have a tendency to overfill that, and you have to then, of course, trim all of that back again. You're going to mess up your marginal ridge. You might have a little initial occlusal interference until you get that trimmed down. So you don't want to go too tall. Too short, of course, you're going to place your margin too low, or you may actually build some composite up over the top of the edge of that band, causing it to be locked in place. The bands of many of the sectional matrix kits out there today are curved in 3 dimensions.